Today's video, we're going over a clinical examination of IT band pain. My name is Dan Pope from FitnessPainFree.com. I'm a physical therapist and coach. We've helped to make thousands of incredible clinicians through our online courses, communities, and mentoring programs. I'm here today to make you 1% better. So IT band pain is the most common form of lateral knee pain in runners. It makes up somewhere between 5 and 14% of all running-related injuries. IT band pain is most common in runners. You're also going to see it in the military population just because there's so much running that takes place there. But you can also see it during cycling. Somewhere between 50 and 81% of all folks that have IT band pain are going to be males. So this differentiates IT band pain from patellofemoral pain, just because with patellofemoral pain, a lot more folks are going to be women. With IT band pain, more folks are going to be males. Pardon the interruption, but I've got something I really think that you're going to love. It's an evidence-based guide to IT band pain. And you know it stinks. You have a patient that comes in, they have a pathology you haven't seen in a while, IT band pain, right? Pops up every once in a while. You don't remember how to treat it well. What does the evidence say? I don't remember. Well, now you don't have to fake it, because my promise to you is I'm going to catch you up to date on IT band pain in under 10 minutes. The evidence-based cheat sheet is a 5-page PDF, and we go over all things IT band pain related. Background, population, biomechanics, anatomy, a mechanism of injury, diagnosis, differential, diagnosis, treatments, and then natural history. Does this thing get better over the course of time? Does it revert to the mean? Well, you got to download it to find out. Best thing is that it's 100% free. So go ahead and click that link in the description, in the show notes, download the cheat sheet, and catch yourself up to date on IT band pain. Back to your video. IT band pain is generally going to be an overuse issue, so oftentimes patients will come in and subjectively say, I recently increased my mileage, or maybe I increased my speed of running, or maybe I incorporated more hills. Just because we run downhill specifically tends to put more strain or tension on IT band. You may also see this more in trail runners, just because when you're running on a trail, sometimes that trail is very thin, and when we're running, we're taking a very narrow stance, which tends to put more varus force on the knee and tensions the IT band. So more trail running might lead to more IT band pain. Another thing to keep in mind is that often with runners, the portion of running that hurts is when their leg swings behind them. So I'm gonna have Kylie go ahead and take a step forward to the right. Good. And a few things are happening here. The biggest and most prominent thing is your TFL is going to be firing eccentrically as your leg swings behind you. And when your TFL fires, it's going to tension the IT band. The other piece is the knee starts to bend. And when we're around 30 degrees of knee flexion, that's when we have the most compression on the fatty tissues underneath the IT band. So folks will sometimes say this position hurts, and then in future videos when you go over treatment, this becomes very relevant. It's also a major reason why downhill running sometimes hurts worse with these folks, just because when we're going downhill, that TFL has to fire even more aggressively. It puts more tension in the IT band. The next thing that's important to think about from a diagnostic standpoint is going to be the anatomy. I've basically drawn out the bottom part of my IT band right here. So one quick trick you can try, and it doesn't work well with all patients, but you can try, is ask your patient to lay with their legs straight and just to lift from the hip. And when you do that, the TFL is going to fire and tensions the IT band. I just have a weird IT band, but you can see it pops out pretty prominently when I do that. And I've tried to, this isn't my normal color of my IT band, I've colored it in so you can see the IT band. But as I lift up, you can see it pop out from the skin, right? And one of the things we're looking for is going to be pain under the IT band a few centimeters more superior to the joint line. So essentially I take my fingers and I'll find the joint line of my knee, which is right about here, and I go about 2 centimeters above that, my pain should be here. We'll talk about this a little bit later, but if I think someone has more joint pain, I'm going to palpate the joint line, and that's painful for folks that have joint-related pain. But I think it's more IT band, it's going to be a little bit superior, about 2 to 3 centimeters superior of that joint line. And after you found the IT band, if you keep on pulling up your patient's pant leg, what you usually find is a phone set to the Fitness Pain Free channel, and you click on the video here, right? Let's see, oh, kettlebell goblet squats, nice. And then go ahead and click on that like button and then subscribe to the channel because, man, what a good channel. Next, we're gonna go over a few special tests you can use to diagnose IT band pain. First test, Noble's compression test. So we have our patient here, Kylie. Essentially, we're gonna feel the knee on the lateral side and we're feeling for the joint line. And once we find the joint line, we wanna feel for the IT band. I'm gonna have Kylie raise her leg just a little bit. You should feel that it pops into your fingers and relax back down. I'm gonna go about 2 to 3 centimeters superior of that on the IT band. And what we're going to do is bend that knee to about 60, compress down on that spot right on the IT band. We're going to fully extend the knee. And what we should find is that around 30 degrees is where we have most compression with the IT band on those fatty tissues underneath. I'm adding extra compression via my thumb. And if it's positive, so if it reproduces your familiar symptoms, then you might start thinking this patient may have IT band pain. Next, we'll try a step down task. So we'll have Kylie stand up here on a low box, and from here, go ahead and perform a step down and come right back up again. Excellent, and then back up. Now, if this reproduces your patient's familiar symptoms on the side of the knee, right by that IT band, then that would be a positive special test. A few things to keep in mind. If someone has a really painful knee and they don't like going down the stairs, you might see more of a hip strategy. So Kylie, show me a strategy where you don't bend the knee, you drop one side hip down in order to accomplish this, right? Yep. So you might end up seeing that, right? Because folks don't want to load that knee. The other thing you can try, because when we are doing a step down task, we are loading the TFL eccentrically as we go down. I stole this test from Rich Willie. If you guys want to learn more about IT band pain, I highly recommend checking him out. But we can do the same exact test, and we try to keep the hip extended. It's almost like a sissy squat. When you step down, lean back, and try to really reach that foot forward and see if that reproduces your patient's symptoms. Go ahead and show me that, Carly. Good. And come right back down, right back up again. How's your knee feel? Good. Good. So no ITB pain. One important thing to keep in mind when trying to figure out the best test for IT band pain is there's no gold standard for ruling in IT band pain. So what that means is you're not going to have any accurate sensitivities or specificities of the Noble's compression test or step-down task. This is a little bit unfortunate, and over the course of time, maybe we'll find a better way to diagnose this, but right now, this is kind of our best guess, and we don't really know which tests are best. Ober's test. So to perform the Ober's test, have your patient lie on their side. You want them pretty close to the edge of the table. What I'm going to do here is I'm going to pick up my patient's leg, I'm going to straighten it out, I'm going to stabilize right here at the hip, I'm going to go into hip extension and drop that leg down and see if the leg goes below the level of the table. What I would say is Kylie is a little bit tight right here. And when I do this test, when I go into hip adduction, I am tensioning the IT band a little bit, so it may provoke your patient's symptoms. Now, a couple things you should know about the Ober's test. So they've actually performed cadaveric studies where they have a cadaver, they perform an Ober's test, they measure the range of motion, and they cut the IT band, and they do the same thing again. What happens is that the range doesn't change, which means that the Ober's test is not a very good measure of IT band tightness. And when they ended up cutting more structures, so when they cut the glute medius and the glute minimus, we had more dropping of the leg below the table. When we cut the hip capsule, it dropped even further. So the structures that limit the Ober's test are going to be more related to the muscles on the side of the hip, glute min and glute med, and also the hip capsule, right? Here's the other thing that's kind of crazy. We always think the IT band is related to too much stiffness of the IT band. That's the reason why we have pain. But what's very interesting is that when folks have IT band pain and we start an exercise program, we measure the stiffness as they start to progress. As they get better, the IT band actually gets stiffer. We see the same thing that happens in the Achilles tendon. As people rehab, they get a little stiffer, meaning the stiffness might actually be good for the IT band. The last piece is that with the tools that we have at our disposal, so things like soft tissue work, tool work, foam rollers, because there's a lot of folks out there doing foam rolling work for the IT band, it's very unlikely we're actually making a change in the IT band. It's too strong, it's too tough. We do these interventions, we're not making any permanent changes to the IT band anyway. So is the Ober's test truly a great test to use in your arsenal for IT band pain? Probably not. And then classically, the IT band probably isn't doing what we think it's doing. And the treatment for IT band syndrome is probably the opposite of what most people think it's supposed to be anyway. So it gets a little complicated. All right, next we'll talk a little about differential diagnosis. So a few things on my mind when a patient comes in and they have lateral knee pain. So one of which would be IT band pain. The other two big ones are going to be meniscus injury on the lateral side of the joint, as well as an LCL injury. And I think what you can think about first is that subjective. If someone has a traumatic meniscus or have a traumatic LCL injury, generally speaking, this is due to some sort of cutting, pivoting type mechanism of injury, and oftentimes they're associated with swelling right away. And we can see that. The other thing we think about is the symptom location. So I have two X's here. We essentially have the joint line here, and we have the IT band pain region right here. And we can differentiate between the two simply by just palpating here and doing a Noble compression test right through here. So that's one way you can differentiate between the two. Now let's say we have a patient that potentially has more of a degenerative or less traumatic mechanism of injury, meniscus tear. We can also take a look at passive range of motion, and we can look at end range extension as well as flexion. So keep in mind, these degenerative tears sometimes behave a little bit like IT band pain, meaning that they slowly come up over the course of time, kind of an overuse thing as well. So to rule these out, we can just take the patient's leg, and from here, try to fully extend. Sometimes I'll bounce hone a few times, see if that reproduces the patient's familiar symptoms. I'll go into full flexion, right? Does this produce any of your normal pain or symptoms? No. So if someone has IT band pain, this shouldn't hurt. But if they have meniscus pathology, you might find this starts to bother them. To further assess the LCL, we can just do some various stress testing. Pretty easy to do. Have Kylie here laying on her back. I'm going to pick up the leg. I'm trying not to get in your way, but typically I would be more over here, just so you guys can see. I'm going to take my hand, and essentially I'm going to be on the joint, and I'm trying to press this way. I usually do this at 0 degrees, and then again at around 30 here. To steal from Mike Reinold, if you take the leg off the edge, you kind of block the inside of the knee somewhat with the table, bend to about 30. I also block here, and I come in and I various test, right? And a positive special test would be, of course, laxity, but the other piece, if it reproduces the patient's familiar symptoms, generally speaking, this would not be positive for folks that have IT band pain. Another thing to be on the lookout for with lateral knee pain, particularly in runners, is going to be a lateral femoral stress fracture. And we can use a Fulcrum test to rule this out. So essentially we have Kylie here. We're testing this side leg. I'm going to have her bring her leg up slightly. I'm going to take my hand, loop underneath, grab onto the opposite side thigh here. And my top side hand is going to apply some pressure directly down. Now, this is a fairly sensitive test. So essentially, if you don't feel anything, that's a good thing. It means we probably don't have to worry about femoral stress fractures. And if we do, then you probably need to go to your doctor for some additional imaging, because there is a chance that your patient does have that. All right, you're pretty good at diagnosing the most common form of lateral knee pain, but are you good at diagnosing the #1 most common form of knee pain, patellofemoral pain? I have a link for you in the corner. Why don't you go ahead and click on that, and we go over how to diagnose and clinical examination of patellofemoral pain. Click on that link, and I'll see you there.